Hey everyone, it's Sarah with registerednursern.com, and in this video I'm going to demonstrate for you how to irrigate a colostomy. So what is the purpose of irrigating a colostomy? It removes stool from the colon using an enema, which is usually warm water, and it can be anywhere from the amount of 500 cc's to 1,000 depending on what the physician orders. And it's an enema given through the stoma. So think of it as an enema that you would give through the rectum. It's sort of doing the same thing, but we're using the stoma. And this is usually a physician's order. You have to have an order to do this. And they may order this if the patient isn't putting out a lot of stool through their stoma, maybe they're constipated, or the patient has chose to do bowel training. And patients, what they can do whenever they're doing bowel training, they can train their colon to put out at a certain time during those irrigations, so they'll be free from wearing a continuous pouch throughout the day, which will be putting out stool throughout the day. So it gives them some free time. Now, what are some key points to remember about this? Okay, patients who are going to have the best success with irrigating their colostomy are patients with descending and sigmoid colostomies. Why? Why are they going to have the best success? Well, let's look back at the anatomy. We have over here our colon, and we have the descending and the sigmoid. Now, whenever the patient has one of these ostomies, they have majority of their large intestine still there. And what is the role of the large intestine? Remember from our last video over colostomies and ileostomies, the role of the colon is to absorb water. So as the stool travels through here, the water is getting absorbed, so once it hits this area, the stool is going to be more formed, so it's going to be easier to irrigate and get our bowel trained. So you may see the ostomy over here, which would be a descending, or you may see it over here, which would be a sigmoid. Now, patients who have an ileostomy are not candidates for this because the stool that's coming out, it's connected over here to the ileum. These patients have liquid stool. It's never formed, and it's very rich in electrolytes and fluids, so we don't want to be messing with that area, so they're not a candidate for this. Now, whenever you're doing bowel training, the patient needs to know that it's going to take about 6 to 8 weeks to get the colon trained. So they need to know that it takes a little bit of time and a lot of dedication, but can have a good result for them if they choose to do this. Not all patients choose to do this. The result will be, like I said earlier, they will not have any bowel movements in between that irrigation, and it frees them up from wearing that pouch. Instead, they will wear a stoma cap over the stoma, which is a very small closed pouch system, and they'll perform the irrigations once they get trained, maybe every day or every other day, depending on the patient's bowel habits. Now, some other things, whenever you are training the bowel, you'll want to teach the patient and perform this at the same time every day. Why? Because we want the colon to get used to putting out its contents at a certain time every day, so a patient can pick what time works great for them to do this and get the colon used to it. And you're going to perform it, best time is about 1 hour after a meal, because this is when the colon is the fullest. You're going to get the most success of helping it get empty. As a nurse, what you want to remember, and let the patient know this, because this process takes time. From start to finish, it takes about 1 hour. So about 5 to 10 minutes for actually instilling the fluid through the stoma, and then another 30 to 45 minutes for the colon to empty itself. Generally, it comes out in episodes, the stool will, and it takes about 30 to 45 minutes for it to be completely emptied. So keep that in mind. And this is normally either performed in the bathroom with the commode, or in the bed with the bedpan, whatever you choose to do and whatever the patient wants to do. Now let me go over the supplies that you will need to perform this. You will need an irrigation bag that holds at least 1,000 cc's of water. You will be putting in warm water in this bag. Generally, you don't give any more than 1,000 cc's. It's usually between 500 to 1,000. Also, it will come with some tubing, and you may have to connect the tubing to the cone, because this cone will be used to insert into the stoma when you give the enema, and you'll just connect it right here. And then here is your little regulator that you will turn on or off as you're letting the water instill into the stoma. Then you will need an irrigation sleeve. This is where the water in the stool is going to collect once it starts draining out. And a lot of times these sleeves come with a clip, and this clip will go at the end of the sleeve just to close it shut so the contents doesn't spill out while you're doing this. Sometimes people just cut this bag to the certain length of what they need and put it inside the commode or the bedpan and just allow the contents to flow through that. But for this demonstration, we're going to be using the clip and we'll be emptying it that way. And I wanted to show you this. This is a flange. It goes over the stoma. It's part of the two-piece system. And what you will do if a patient's having a two-piece system, you will just simply take your irrigation sleeve and just clip it, snap it onto the barrier. So whenever you are doing this procedure, it'll allow the stoma to let the contents collect in the sleeve. But if you're using a one-piece system, you'll need to get a faceplate and an ostomy belt to help you do that. So make sure that you get the right supplies before you start this procedure. Also, another thing you'll need is water-soluble lubricant, because you will be using this to lubricate the cone before you insert it into the stoma. You will need several pairs of gloves because you'll be changing them in between. And also, it's a good idea to wear a gown to protect your skin and your scrubs from getting splashed with stool and the contents coming out, especially if you're going to just be letting it drain down into the commode or the bedpan, because there's a risk of splashing. And you'll want some washcloths with warm water to provide stoma care before and after the procedure, and some towels just to protect the patient's gown. First, perform hand hygiene. Then put on your gown and gloves. Now fill your irrigation bag up with warm water. And before you do that, the trick, make sure your regulator is in the off position, because you don't want to fill it up and all your water spills out. After you fill the bag, you will want to hang it, and hang the bag where the bottom of the bag is about shoulder length to the patient, because you want it at this level so the solution doesn't go in too fast, which can cause some discomfort and cramping to the patient. Now, so we have water in our bag, but the most important thing you want to do is you want to prime this tubing just like you would an IV tubing, because we don't want all this air going into the patient's gut. It's going to cause them some major discomfort. So what you want to do is you just want to open the valve up a little bit on your regulator, because remember, we closed it when we filled it, and we're just going to fill this whole tubing with water. So I'm going to open it. And it's going through there, and we're making sure we get all the air bubbles out. And there we go. Okay, so our tubing is nice and primed, and we're ready to go. Now what you want to do is you want to clean the stoma. You want to remove any stool that may be on it. So you'll just take a washcloth with warm water and just gently clean the area. Sure it's nice and clean. Then dispose of that, and then what we want to do, we want to lubricate our smallest finger. And what we're going to do is we're going to be inserting it into the stoma, because we want to feel the angle of how the bowel is, because that's how we're going to insert our cone. So just put a little lubricant on the finger. And whenever you insert into the stoma, be aware that it can tense up or freeze up a little bit. And if that happens, just stop and then let it relax, and then gently fill. Don't force. So I'm just going to gently insert and just feel the angle. Okay. Now what we're going to do is we're going to change our gloves, perform hand hygiene, and put on a new pair of gloves. Now we're going to attach our irrigation sleeve onto the faceplate of the flange. Now, before you do this, if you're not using the commode or a bedpan, which would allow the the stool to go into that, instead you're going to clip the bag. Don't forget to clip your bag. So take the clip and then just take it towards the end of the bag and just snap it shut. And then take your irrigation sleeve, and if you're using the two-piece system, you'll just attach to this. If you're using the one-piece, you'll use the faceplate and the ostomy belt. And it'll just snap on there and stay in place. Okay, now we're going to lubricate the cone, but first what you want to do is you want to open that bag of the irrigation sleeve a little bit first, because you're going to get lubricant on your hands, and when gloves and lubricant do not go together, it's really slippery. So we've opened the sleeve of the irrigation sleeve, and then we're going to lubricate the cone and get it nice and lubricated so it's easier to insert into the stoma and it's not painful for the patient. So after you get it lubricated, you're going to go in and remember what angle that the stoma was at. So that will be the angle that you insert the cone. And you'll insert it just enough without causing too much force, but you want it in enough where when you instill the contents, it doesn't leak out. Now you're going to open up the valve of the irrigation bag by turning it to on, and you're going to do it slowly so the water goes in slowly. You don't want it too fast or too slow. If the patient starts reporting cramping or nausea, turn it back off, let them feel better, have them take a breath, and then start slowly again. And remember, this process takes about 5 to 10 minutes, and we want all of this to infuse of what the doctor ordered. After you've instilled all of the water, wait about 10 seconds, then remove the cone from the stoma and dispose of that properly, and then be sure to seal the sleeve of the irrigation sleeve, and have the patient hold the contents for about 30 to 45 minutes, and you will notice that over that time, spurts of stool and the irrigation fluid that you instilled will come seeping out, and it'll look something like this. And as you can see here, the irrigant in the stool has come out, and what we're going to do is we're going to remove this irrigation sleeve, and we're going to provide stoma care, replace the flange, the skin barrier. And you'll want to chart this per your hospital protocol, however they require, and you'll want to talk about what you done, how you explained it to the patient, how they tolerated it, and how much came out whenever you measured it. And your documentation could look something similar like this if you're using the FDAR format. Okay, so this wraps up how to irrigate a colostomy. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.